Welcome to the Total Hip Replacement Education presentation. You may wish to listen to this several times, maybe with a family member or a friend. You may wish to make a note of questions you have, and when a member of the therapy team calls you, they will be able to answer those queries. Having a total hip replacement is all about you. You have elected to have this surgery to relieve your pain, improve mobility of your joints, and improve your quality of life. We would like to take this opportunity to make you aware of your role and responsibility in making the operation a success. The aims of this presentation is to help you understand what is expected of you before, during, and after your stay in hospital. Teach you important exercises to start doing regularly now and to carry on doing through the immediate post-op phase. To advise you about hip precautions and to help you plan and prepare your surgery. Before you come in, you need to be prepared to work hard physically and mentally to get the best from your joint replacement. You'll need to learn the exercises and practice them so that you can build up the strength and condition you need for a quick and effective recovery. Your success is dependent on your effort and what you put into it. The surgery may only take 2 to 3 hours, but your rehab can take up to 6 months. Also, be prepared to get out of bed with your operated leg leading. You may need to swap to the other side of the bed for the first 6 weeks post-op. You'll need to plan ahead. Think about your meals. Can you batch bake before you come in and freeze them, or can you buy ready meals? Who can help with your housework, to help with the hoovering and the heavy laundry? Is there somebody that can help with your shopping? Also, it's worth thinking about entertainment. So, is there a book that you've been meaning to read for a while, or a box set that you could watch while you're resting? Who will walk the dog whilst you're limited in the amount of walking you're allowed to do? Who is going to bring you into hospital and take you home from hospital when you're discharged? You are going to be in hospital for the shortest time possible to avoid the risks of infection and to get back to the best place to recover, which is your own home. So what are the precautions after a hip replacement? For the first 6 weeks, to prevent dislocation, we need to stick to some rules. Do not bend your operated hip beyond the 90-degree angle. So no leaning forward to pick things up off the floor, and no leaning forward when you're sitting in a chair. Do not cross your operated leg over the midline of the body, either at the knees or at the ankle. Do not turn your operated leg inward in a pigeon tone position. Do not twist your upper body when standing and reaching for items, and do not sit in a chair that's too low for you. You will be sent a questionnaire to complete with some home heights on. After discussing your questionnaire with you, we may provide some toilet equipment such as raised toilet seats, freestanding toilet frames, and a combination of both. You may also need chair raisers, bed raisers, and perching stools to help strip wash. Equipment you can buy for yourself to promote your independence and maintain your precautions are a long-handled sponge to help wash your feet, long-handled shoehorn to help with shoes, a helping hand to help dress and pick up items from the floor, and a sock aid to help with socks. Exercises are very important. These exercises should be started as soon as possible. Aim to do them 3 times a day, so typically we would want you doing them in the morning, at lunchtime and in the evening. You will find some easier than others because your body has adapted over time to avoid pain. Please don't just do the easy ones. Try all of them. They will become easier, so where you may start being able to manage only 1 repetition, you may find that soon you can do 5 or even 10. These are the same exercises that you will do post-op. And remember, don't push yourself into more pain. Deep breathing exercise is the first exercise. This exercise helps to maintain a clear and healthy chest. Your chest is more susceptible to infection after an operation due to sedation and prolonged lying in bed. Take a deep breath in through your nose, hold your breath for 2 to 3 seconds as able, and then breathe out through your mouth. If you feel any phlegm in your throat, cough to clear it. Repeat this 3 times. Foot and ankle exercise. Do this for 10 seconds. This one can be practiced more than 3 times a day. This exercise helps to maintain good circulation and to prevent blood clots forming. Move your ankles briskly by pointing your feet up and down. Place a plastic bag under your heels to reduce the friction. Static gluteals, which are your bum squeezes. Lying on the bed or sitting in your chair, squeeze your buttocks together and hold the squeeze for 5 to 10 seconds. Relax and repeat 10 times. This exercise will help to control your hip, ready for standing and walking. Static quadricep exercises, which is a knee straightening exercise. Lying down or slightly reclined, bend your ankles by pulling your toes towards you and tighten the muscles in the thigh to draw your kneecap up towards your hip. Hold for a count of 10 and then relax. Repeat this exercise 10 times. This exercise is very important and helps you to stand with a straight leg on your operated side. Inner range quadriceps, a knee extension exercise. Lying down on a bed with a rolled blanket or towel underneath your knee. Keep your knee resting on the blanket or towel. Lift your foot off the bed to fully straighten your knee. Slowly lower your foot back down into the starting position and then repeat 10 times. Slide exercise. Whilst lying down on the bed as flat as you can manage with a plastic bag under your heel, slide your foot up towards your bottom, bending at the hip and knee. Then slide your foot back to the starting position. Do not bend more than your hip proportions, so the 90 degrees, and repeat this exercise 10 times. Slide exercise. Lying down on a bed with a plastic bag under your heel, slide your affected leg out to the side as pain allows. Slide your leg back to the middle position, but do not cross the midline. Repeat 10 times. Getting into bed after your hip operation. Sit 3/4 of the way down the bed, where the star number 1 indicates. Move your bottom back until the back of your knees are touching the edge of the bed and your feet are off the floor. With your hands on the bed behind you, move your bottom diagonally towards your pillows. Once your good leg is on the bed, bend that knee and dig your heel in to help move your bottom up the bed. Your operated leg will follow onto the bed without you having to lift it. Getting out of bed after your hip operation. Move your operated leg out to the side. Move the other leg to meet it and keep your legs together. Bend your non-operated leg and dig your heel into the bed. Using your hands, sit yourself up and move diagonally down the bed to sit on the edge. Move forwards so that your feet are both on the floor. We will practice this with you in hospital and make sure that you're managing it independently. On the day of your surgery, you'll need to shower at home and come into hospital in clean clothes. Remember, loose clothing and comfortable clothing is very important. You'll be admitted by the nursing staff. The anaesthetist will come and see you and review you, and you may be seen by your surgeon. You'll have a pre-op with the therapist to practice with elbow crutches and step and stairs, and they'll go through your exercises with you. You'll then go to theatre, where you'll have your operation, and you'll come back to the recovery room before coming back to the ward. Back on the ward, start doing your static gluteal exercises and your static quad exercises. You will need to wait until the numbness in your legs wears off if you've had a spinal anaesthetic. We aim to get you up and out of bed in the afternoon or the evening and have you changed out of your theatre gown and back into your own clothes. Back on the ward, you may have Flotrons on, which intermittently compress your calves. This is to prevent clotting. These may stay on overnight. You may have fluids via a drip, and you may have oxygen via nasal specs or a mask. The day after your surgery, you may be seen several times by the therapy team. They will go through your exercises. They will remind you of your hip precautions. They will get you standing and walking with a Zimmer frame and soon progress you onto your elbow crutches. They may practice dressing without bending down. And they will practice transfers at your home heights, so getting on and off the bed, standing and sitting on the chair, and on and off the toilet. They will then practice step and stairs. When you are safe with your walking and your transfers, so on and off the bed, on and off the chair and toilet, you're managing step and stairs, and you are medically fit, you will be ready to go home. This may be on day 1 after your operation. You will go home with all the medication you need. Getting in and out of a car. You will need to travel in the front passenger seat. You will put the seat back as far as it will go, and you will recline the back of the seat. You will sit down on the seat and manoeuvre backwards to the centre of the car. As you swing your leg over the sill of the car and into the footwell, you will need to lean back. Take care not to bend past the 90 degrees. A tip is to add a plastic bag to the seat to make the manoeuvre easier, but remember to take it out before moving off. Getting out of the car, you reverse the procedure. Legs out first, and remember to slide your operated leg out in front of you before standing up. After the operation, when you return home, you'll need lots of rest. Try to rest on the bed at some point in the day to allow your hip to be in a straighter position. This will allow the swelling to go down and allow your hip to heal. Keep going with the same exercises you were doing in hospital, and any walking should be with both elbow crutches. Remember, walking is not a cure, only a little at a time for the first 2 weeks. So what are our expectations? We ask that you and your relatives read the information booklets that are given to you, listen to the advice that we give, ask questions so that we can reassure you, arrange help if you need it with shopping, cleaning, laundry, and maybe washing your feet. Arrange your home environment, so clear away rugs, trailing wires, and make room to walk around with elbow crutches. Plan your transport home. A normal family car is absolutely fine. Prepare meals. Ready meals or freezer meals are perfectly okay. Seek advice to stop smoking and eat well. And start your exercises now.